Mr. President, election night this past Tuesday should have been a wake-up call for many of my colleagues in the Senate. Americans lined up at the ballot box to demand the Trump administration start addressing America's affordability crisis. These voters want to go to the grocery store or doctor's office without breaking the bank. But the president, I'm not sure, is even listening. Despite President Trump's promise to bring prices down on day one of his administration, Americans have been paying more for their groceries, electricity, and rent throughout this first year of his second term. And in 2026, they'll be paying far more when it comes to health care. You see, President Trump said on the campaign trail that he had, quote, concepts of a plan, close quote, concepts of a plan to make health care affordable. His real plan, and the Republicans' plan they've been following for the past year, unfortunately, is going to mean Americans pay dramatically more for their health care. In July, congressional Republicans passed it, you remember the name, the Big Beautiful Bill, President Trump's budget bill. It cut Medicaid by $1 trillion, and it's going to result in more than 10 million people losing their health insurance. Those cuts were not enough. As they unilaterally wrote and passed the so-called Big Beautiful Bill, congressional Republicans also refused to extend the Affordable Care Act's enhanced premium tax credits. What is an enhanced tax credit? It means that you receive help from the government to pay your premiums for health insurance. These tax credits help more than 20 million people in America afford health care, and President Trump and my colleagues on the other side of the aisle are choosing to let these credits expire at the end of this year. Last week, people in my state of Illinois started receiving letters informing them of what's in store if we don't do something about this Republican action. They're going to find out through the mail what's going to happen to next year's health insurance premiums. They won't like it. And for those in my state who access health care through the ACA, these letters inform them their premiums will increase by an average of 80%, or an additional $2,500 per year. $2,500, folks. How's that on your family budget? I know what it is. It's a killer for a lot of people. But for many others, those premium increases will even be higher, doubling and tripling what people are actually paying today. Folks don't realize this. They will soon when they receive these letters. That's what they're in for. What does it mean for many families in my state? Devastation. I want to read some of the messages I've been receiving from constituents across Illinois now that they see what happens to their hospitalization premiums because of this Republican action. Todd is in Petersburg, Illinois, which is a small town in the middle of the state. He wrote to my office and he said, quote, in 2025, I had a good plan, which is around $560 a month for health insurance. Sadly, my option now has a monthly premium of $1,400. Almost triple what he's paying now. Scott from Glen Ellen, a suburb of Chicago, wrote, and I quote him, my daughter just received her 2026 premium notice. Without any help, her cost will increase from $232 a month to $788, triple what she's currently paying. Phyllis from DuPage County wrote, I lost my job and I've been on the ACA Marketplace plan. Last year, my plan with dental and vision cost me $162 a month. This year, without a subsidy, prices are going up to $1,136, from $162 to $1,136 a month, with a higher deductible, more copays, and no vision or dental coverage. She concluded, this amount they're asking for my health insurance is more than my monthly mortgage. It's not affordable living in this country anymore. If Republicans don't come to the negotiating table, Scott's daughter will see a $6,600 premium increase, Todd will face a premium increase of $10,000 plus, and Phyllis will pay $12,000 more for her health care. What family can handle that? These are real stories from real families, real results of action that's been taken in the Senate. People are going to pay thousands of dollars more for their health insurance, and some will drop it. The Director of Insurance in Illinois estimates that 30 to 40% of the 500,000 people who are under the Affordable Care Act in Illinois will drop their coverage. Will they get sick in the future? Sure they will. Will they show up at the hospital even if they have no insurance? Of course they will. Will the hospital treat them? Yes. Who will pay for that treatment? all the rest of us because of this Republican action eliminating this tax credit. So what has President Trump been doing as my constituents receive these awful notices? In the last month, he launched a $40 billion bailout for Argentina. $40 billion. We didn't vote for $40 billion. He just announced it. He started construction on a grand new ballroom for his billionaire buddies at the White House, insisting it won't cost the taxpayers any money at all. And he bought 2 new private jets for Kristi Noem, the Secretary of DHS. And last week, he threw himself a lavish Great Gatsby-themed Halloween party at Mar-a-Lago. Voters are fed up, and they showed it last Tuesday. As a president lives like a king, Americans are rejecting Republicans who show more interest in fawning over the president than lowering the cost of living. There'll be more election Tuesdays like this one if President Trump and the congressional Republicans continue to refuse to sit down with Democrats and find a way out of this shutdown. We should be meeting today to open this government. We need to address this health insurance problem. It affects every district. In fact, it affects red states, those who President Trump carried more than blue states. It's a national problem created by the Republicans and needs to be fixed by them. They've got to join us in this effort. There is no reason we can't find a deal and stop millions of Americans from paying double or triple in health insurance premiums, because the American people deserve so much more than mere concepts of a plan when it comes to health care. I yield the floor.